How do you know if your child's at risk for iron deficiency? My child looks pale and is tired all the time. Is that a sign of anemia? How do you check for that and how to prevent it? This video is all about the basics of iron deficiency anemia and the most common mistake that parents make that may contribute to iron deficiency. Who's at risk, symptoms, and how to diagnose, supplements, and treatments. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered, integrative approach to solve their children's health issues. So if that sounds like you, make sure to subscribe to the channel for more content just like this. We hear about iron deficiency and anemia often from our pediatrician's office and from marketing that sells iron supplements. Anemia is a condition where your body is not getting enough oxygen in the blood. There are several causes for this, but the most common cause of anemia in children is iron deficiency anemia. Iron is the core building block of hemoglobin, which is a molecule that works to transport and deliver oxygen to different parts of the body. In essence, when your body is low in iron, it is ineffective in making hemoglobin molecules that the body needs to effectively store, transport, and deliver oxygen to different parts of the body. Children can become iron deficient through these mechanisms. Inadequate intake. Most full-term babies are born with iron stores that is sufficient for at least the first 4 months of life. So by 4 months of age, most babies' iron stores will have decreased to about 50% as newborns use iron at a high rate for blood volume expansion and accelerated growth. Most preemies deplete their iron stores even faster within the first couple months due to an even faster growth rate after birth compared to full-term babies. For adequate intake in the first year, a baby generally needs about 0.8 milligrams per kilogram of body weight per day of elemental iron. In breastfed babies, most pediatricians will recommend starting iron supplementation by 4 to 6 months of age and continuing through the first year of life. In babies who are formula fed, most formulas are iron fortified to meet the daily requirements. Poor absorption. There is extensive evidence that shows too much cow's milk consumption leads to iron deficiency. Milk displaces iron-rich foods and inhibits absorption. Number 3, blood loss. Too much cow's milk intake can also cause chronic inflammation in the gut that leads to micro tears and blood loss from the intestine. Blood loss in menstruating female teenagers can also increase their risk for having iron deficiency anemia, especially if the amount lost is more than what's taken in through diet. What are the other risk factors for iron deficiency anemia in infants and children? Well, for one, prematurity. Over 80% of the infant's iron storage is accumulated in the last trimester. Also, premature infants have lower levels of hemoglobin, iron, and their daily requirement is higher as their bodies are growing rapidly and require higher amounts of iron compared to a baby who's born full term. Secondly, exclusively breastfed infants, many studies have consistently shown that breast milk alone does not meet iron requirements for most infants. Mothers who've had a history of iron deficiency and those who breastfeed their infants exclusively. And also older infants and toddlers who are relying heavily on milk intake and not eating so much. Which leads me to 3, picky eaters. Picky eaters who's on a lot of dairy or eating too little iron-rich foods are also at risk. Lastly, teenagers with heavy menstruation. These are usually seen in teens with heavy periods or those who are menstruating combined with inadequate iron intake from their diet. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Symptoms and diagnosis. Now, in infants, symptoms of iron deficiency can be subtle and often missed. In severe cases, babies can show delayed developmental milestones in fine motor and gross motor, social, and speech areas. This is also why most pediatricians have a low index of suspicion and will screen the risk for iron deficiency based on the baby's feeding, physical exam, and developmental milestones. In older kids, iron deficiency anemia can present with, yes, obvious pallor, but also social withdrawals, delayed speech, and developmental delays. As the degree of anemia gets worse, fatigue, exercise intolerance, rapid heart rate, cardiac dilatation, and heart murmurs may also develop. So why is it important to catch it early and treat it? Iron deficiency anemia in infancy and early childhood can cause developmental delays and behavioral concerns that may be irreversible. Studies show that infants with anemia have lower developmental scores, which improve after oral iron supplementation. Also, the duration and severity of iron deficiency matters. That means the longer the duration or more severe the deficiency, the more it impacts the child's cognitive development. A study of 5-year-old children showed that those who have had iron deficiency in infancy score lower on motor and developmental assessment. All this to say that this is something we want to treat early and be proactive about because it can make a long-lasting difference. Diagnosis. The easiest way to check iron levels and anemia is through blood work. Your doctor will likely order a complete blood count and look at the hematologic biomarkers like hemoglobin, the MCV, short for mean corpuscular volume, and RDW, short for red blood cell distribution width. To help you understand what each mean briefly, hemoglobin is the oxygen-carrying molecule where most of the iron in the body is stored. So the level helps us detect anemia. MCV is the mean volume of the red blood cells, which helps us categorize a type of anemia, like microcytic anemia, macrocytic anemia, and normocytic anemia. Iron deficiency anemia is considered a microcytic anemia. RDW tells us the amount of variability in the size of red blood cells, which increases in iron deficiency. Additionally, your doctor may also order other helpful biochemical markers in the blood that help us quantify iron deficiency. Now, these are the main players. Number 1, ferritin, which reflects the total level of iron stored in the body. Total iron binding capacity measures the availability of iron binding sites. So when iron levels decrease, the total iron binding capacity goes up as your body is trying to get more iron. Iron levels, well, contrary to the obvious, measuring the serum iron is not that helpful because the amount of serum iron can greatly fluctuate within a day from time to time and between meal times, illnesses, and inflammation. Treatment. If you already have a clear diagnosis from your pediatrician that your child has in fact iron deficiency anemia, it is important to talk about treatment. We begin always at the root of the problem. If the root of the problem is excessive cow's milk intake or inadequate solid food intake in a young child, then the first thing is to consider implementing reducing the amount of milk in your child's diet. When you're able to reduce the milk intake, your child will naturally develop an appetite for more solid foods like iron-rich cereal, green leafy purees, beans, and maybe even lentils. I would be remiss to not talk about iron-rich foods, which include eggs, red meat, sweet potatoes, green leafy veggies like cooked spinach, lentils, beans, chickpeas, tofu, and canned sardines. If you have a particularly picky eater, don't forget about the iron-enriched foods like cereal, breads, and pasta. Try to avoid milk with iron-rich foods as milk can impair iron absorption in the body. Instead, try offering vitamin C-rich foods along with these iron-rich foods, such as berries, oranges, and broccoli. These will pair well with iron-rich foods and enhance your body's ability to absorb iron. Now, if the root cause of iron deficiency is from blood loss, either from the gut as in having a food allergy or from menstruation, then your doctor will likely formulate a plan to treat those issues in order to stop blood loss where iron is lost from the body. What about iron pills? Yes, as I have alluded to earlier about studies on oral iron supplementation, this is for the most part an effective way to replace iron and to treat iron deficiency anemia. In kids, the treatment dose is 3 to 6 milligrams of elemental iron per kilograms of body weight per day, divided per day up to 3 times a day. For infants, you can find liquid forms of iron supplementation like these over the counter. For older kids, iron supplements come in forms of dissolvable tablets, powders, and chewable tablets like these. Once you start an iron treatment, be sure to monitor and recheck iron labs with your pediatrician to track improvement. One thing to keep in mind, when your child has iron deficiency anemia, you will need a higher daily dose of iron than what most children's multivitamin has. So just taking a multivitamin with iron is not enough to treat iron deficiency. It might be good for prevention or maintenance in children who are not iron deficient. If you made it this far, thank you so much for tuning in, and I hope you have some takeaways on what you can do as a parent to help your child who has iron deficiency anemia. Remember, iron deficiency anemia is not a lifelong condition. It is treatable, and understanding the root cause empowers you to make the most effective change. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.